knock on doors, sanitize my hands. Hi, my name is Alan Michelle, and I'm going to do a full head to toe assessment on you. I am going to be remaining on your right side for most of the assessment.
Okay.
How are you today? Do you have any concerns?
I'm good, no.
Awesome. So this is Omar. He is a 19-year-old male. He is well groomed. He looks his age, and he does not seem to be in any distress. Upon visualization of his head is symmetrical. There's no lesions, no masses, or any nodules moted. I am going to palpate with my hands. I had already sanitized. And let me know if you have any tenderness. Any pain?
No.
Awesome. So as I'm palpating, there's no masses, no tenderness, noted by patient, and there's also no soft spots. Next I'm going to do is the whisper test. So I want you to close one ear. I'm going to stand behind you 3 feet. I'm going to say a word and let me know what you hear.
Whisper.
Awesome. So the correct word was whisper, and the patient got it correctly. I am going to dim the lights now. I'm going to assess for your eyes, and I'm going to assess for your pupils if they're reactive to light and their accommodation. Your sclera is white. There's no drainage noted. You are wearing glasses. You can remove your glasses for me.
Okay.
I want you to look straight ahead. Good. So pupils are equal. They are both a +3 before light, +2 after light. They are brisk, they're round, and they're reactive to light. Next I'm going to do is I'm going to do accommodation. We're going to check for your extraocular muscle movements. So what I want you to do is I want you to follow the phone.
Okay.
Up and down, forward in, forward out. So patient's extraocular movements were intact and there was no distress noted upon. Next, since I'm down here already, I am going to check for the patient's mouth. So the nose is midline, the mouth, there's no lesions noted. I am going to ask you to open your mouth for me and stick your tongue out and say ah. Awesome. So teeth are intact, the tongue is intact, pink and moist. The uvula is also midline and it moves. Next, I'm going to assess for your tonsils. Again, stick your tongue out. Did you remove your tonsils?
Yes.
Okay, so your tonsils are a grade 0 and they are actually removed. Next, I want you to stick your tongue out and move it from left to right. Okay, so cranial nerve number 9 is intact. Cranial nerve number 12 is intact. There was no lesions noted, no masses noted, and if there was a glove with me, I would feel for any masses as well. Next, I'm going to turn the lights on actually back so we can get some light in here, and I'm going to assess for your lymph nodes. So the first thing I'm going to do is, can I ask you to stand up for me? And I'm going to put the camera like that.
Sit here?
Yes. And I want you to actually, you know what? Stand up for me.
Okay.
Come over here and just face the camera. Thank you. So now I'm going to palpate. So I'm palpating for your preauricular lymph node, and then your postauricular lymph node, your occipital lymph node, tonsillar lymph node, submandibular, submental, superficial, post-cervical, deep cervical, and then hunch your shoulders, and then your supraclavicular lymph nodes. Any tenderness?
No.
So no swelling noted, and no tenderness noted as well, and no inflammation. Next, I'm going to inspect your neck. Just look straight ahead. I'm inspecting for the thyroid gland. There's no goiter present. I am going to feel for your neck, and I want you to gulp when I tell you to gulp, like you're drinking water. Go ahead. Awesome. So when the patient's swallowed, there was no tenderness noted and no nodules or inflammation. Next, I'm going to feel for your carotid. So I'm going to feel each one. Good. So left and right, they're both a +2. I am going to listen with the bell of my stethoscope for any thrills or any bruits. Good. So no thrills or no bruits noted. I want you to just put your ear to your shoulder and the other one as well. Neck, chin to chest, and then back, head back. Awesome. So range of motion is intact. 5 out of 5 full strength. Great. So next I'm going to do is I am going to listen to your lungs. So you seem like you are not in any distress. You seem like you're breathing, unlabored breathing. and equal. So there's no accessory muscles to be used to breathe. I just want you to move your head a little bit forward, your body forward. I'm gonna listen to the back of your lungs, and just take some deep breaths, okay? And I'm gonna listen with my diaphragm. Good. Okay, say E for me.
E.
Awesome. So agaphony is negative. Lung sounds have been heard clear bilaterally. No wheezing noted, and they were clear. Next, I'm going to listen to your anterior lung sounds. So I want you to face your head to the left side, and then I'm going to ask you to do some deep breaths for me. And your lateral lung sounds. All right, so no adventitious sound heard, no rhonchi, rales, or any wheezing noted as well. Next, I'm going to have you actually lay on the bed right now there for me. You can get under the sheets, that's perfectly fine for your comfort. Are you comfortable?
Yeah.
Okay, awesome. So. Perfect. So I am going to have to ask you to lift your shirt a little bit. I'm going to assess the skin of the patient. There's no moles. Skin is appropriate to patient's ethnicity. There's just a little bit of hair, but that's normal in this patient. I am going to feel for the maximal point of impulse. Okay, perfect. So the point of impulse, it has been noted. I am going to listen to your heart sounds now. So I'm going to take my stethoscope and I'm going to listen in the right sternal border and the second intercostal space for the aortic, and then the pulmonic and the second intercostal space left sternal border. Third intercostal space left sternal border is the Erb's point. Fourth intercostal space is in the left sternal border tricuspid. And then fifth intercostal space for the mitral and the left sternal border. Good, so S1 and S2 have both been heard. I'm going to have you still stay right there. I'm going to switch to the bell and I'm going to listen for any murmurs. So again, in the fifth intercostal space for the mitral valve. And then we're going to move on to the tricuspid. Good, you put your shirt down. Erbs. Pulmonic. And aortic. So no murmurs noted, and no adventitious sounds heard. Next thing I want you to do is I want you to just kind of swerve to the edge of the bed. Swerve to the edge of the bed. Yeah, just sit like at the edge of the bed. And what I want you to do is I want you to just sit straight and I want you to blow out and hold your breath. I'm going to listen in the second intercostal space for mitral stenosis. So no mitral stenosis noted. Again, go back and I want you to lay on your left side, which is over here. Lay on your left side. Face this way on your left side. And I'm going to listen in the fifth intercostal space. Okay, no mitral stenosis noted. You can lay on your back now. Next, I'm going to assess for the JVD. So I'm going to ask the patient to put a pillow behind your head so we can assess for the JVD. I'm going to put out a 30-degree angle. So I want you to lift your head a little bit and we'll go from left to right. And then the other one. Good. And now I'm going to palpate. And then as well. So there is no jugular vein distension noted in the patient. Next we're going to do is the abdominal assessment. So I just want you to lift your shirt up for me, please. I'm looking at the patient's skin and the surface, the contour. The abdomen is round, non-tender, it's symmetrical. There's no tenderness noted, there's no masses noted upon visualization. Are you having any stomach pain?
No.
And did you void before you started the abdomen assessment? Awesome. So I am going to auscultate before percussing or palpating your abdomen. So I'm going to use my diaphragm and I'm going to palpate in all four quadrants. So normally I would listen to 5 to 34 per minute, but for the purpose of the video, we're not going to be doing that today. But you do have normal active bowel sounds. I also did not hear any abdominal mass or pulsatile. I did not see any of that. Next, I'm going to listen for any bruise. So I'm going to do that with the bell of my stethoscope, and I'm going to listen for your renal arteries on both sides, iliac arteries on both sides, and then femoral arteries on both sides. So all 4 bowel sounds in the right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant are normal active bowel sounds, and there's no abnormal bruise heard upon auscultating. Next, I'm going to percuss in all 4 quadrants. I'm just going to be percussing for any tympany or any dullness that may have been noted. I will not be percussing your liver or your spleen for the size of it for the purpose of the video. So general tympany is present. There's no dullness noted, and that's pretty much where we're at right now. So there's no underlying masses or organs as well. Next, I'm going to palpate with warm hands. I'm going to palpate lightly. Just let me know if you feel any pain with one hand.
No.
Good.
No. No. And no.
Okay, so there's no increased tenderness. There's no increased tenderness or resistance noted, so that has all been ruled out. No rigidity, no guarding, or any, like I said, rigidity noted as well. Next, I'm going to do a deep palpation with both my hands. And I'm noting for any masses, tenderness, pulsations, mobility with respirations, or any pressure. No tenderness noted. Your abdomen, like I said, it's soft, it's non-tender, and it's appropriate. And yeah, we're not going to be doing any special assessments throughout this assessment. Next, I want you to sit back in a sitting position.
Okay.
And just sit at the edge of the bed for me, please. Perfect. Do you feel any dizziness at all?
No.
Awesome. So right now I'm going to inspect for your upper extremities. I am looking at your upper extremities. The joint involvement is symmetrical. So the joint involvement is symmetrical. There's no deformities or misalignment of your bones or joints. There's no skin changes. Have you seen anything in the past?
No.
Nope. So skin's intact and range of motion is intact as well. I am going to palpate your upper extremities with the back of my hands. For temperature, temperature is warm. There's no crepitus involved. Can I see your hands? I'm going to palpate your radial pulses. They're both a +2. No signs of inflammation when noted when inspecting and palpating. I'm going to test your range of motion. I just want you to lift both your arms out, just like that. Awesome. So range of motion is intact. 5 out of 5, full strength. Next, I'm going to assess for your lower extremities. So in your lower extremities, again, I'm looking at the skin lesions. There's no skin lesions, no nodules or masses noted. When we're palpating the back hands, I'm checking for temperature. Temperature is warm. I'm checking the pedal pulses. Both are a +2, and there's no other tenderness noted. Did you feel anything? Do you have any concerns down there? Awesome. So I'm going to check your range of motion. I want you to stand up and just flex your knee to your chest. Awesome. You can do that on the other one as well. You can have a seat back. So full range of motion, 5 out of 5 strength. Next we're going to do the patellar reflexes. So I'm going to take all right, so with the patellar reflex, I'm just going to hit a little bit. I just want to assess it. Awesome. So when we're doing that, there was contraction of the quadriceps when I had hit the with extension of the knee when I had hit the patellar reflex. Next, I'm going to assess for your CVA tenderness. You can actually stand up for me, and I'm going to take my fist above my other fist, and I'm going to percuss over here in the back, and I'm just going to assess for any CVA tenderness, which is basically, I'm just assessing for any pain in that area. Really loud thud. Do you feel any pain?
No.
Awesome. You can have a seat. So no CVA tenderness noted when percussing. Next, we're going to do, actually, you're going to stand back up. I apologize. We're going to do the Romberg and gait test. So the Romberg and gait test, you're gonna just walk all the way to the end and come back to me. Awesome. And now you're gonna do the Romberg test. So I want you to stand right there, and I want you to open your eyes and basically put your feet together, and I want you to close your eyes for 10 seconds. Usually you do it for 30, but for the purpose, we're doing it for 10. I'm gonna stand right next to you. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. So the patient was able to maintain in an upright position. There was no swaying involved, but even if there was minimal, that's okay. So right now my assessment is complete. Thank you so much for your time. I will be taking all of my information that I have collected throughout this assessment, and I will be bringing it back to the medical team and bringing it to you to figure out what interventions we can work on.